Welcome back, everyone. Last session, we looked at our role as assessors and support workers and how to make sure every assessment is person-centred, respectful, and empowering. We learned that we adapt how we prepare, where we conduct the assessment, and what supports we use so that the individual can truly participate and show us what they can do. You should now feel confident that you can set up an assessment in a way that is safe, supportive, and compliant with both organisational and legislative requirements. In this session, we'll focus on how to conduct the individual assessment. This means gathering accurate information through respectful observation and communication. We will look at how to build rapport, ask effective questions, and record what we see objectively. Remember, our goal is to make every assessment person-centred, where the customer feels safe, respected, and understood. So, building rapport. Start every assessment by creating a comfortable environment. Use introductions and small talk to set the tone. Explain what will happen, reassure the customer that it is not a test, and always use active listening. Repeat or paraphrase their responses to show that you have understood. So let's do a little bit of a role play, for example. Where the assessor greets the customer, confirms consent, and explains the purpose clearly. Hi, my name is Alex Reynolds, and I am the Clinical Support Lead at Anglicare SA. And you have a truly beautiful home, George. Is it okay for me to call you George? Great. And I noticed these cards on your mantelpiece. Have you recently had a special birthday in the family? That looks like an excellent fun party. Cool. Well, George, today I am visiting you to check on how you are managing on your own and whether we can support you moving forward to help you do less chores and leave you more time free to do more enjoyable things in your life. I'll be doing this by asking you some questions, listening to you, and making some notes as I go. I may even ask you to show me some examples. For example, how you get on and off the toilet. Then I will go away. I will look through all your answers and the assessment generally. And after I have done that, I will book another time with you to visit again and go through the results of the assessment and make sure you are happy with the outcome and any recommendations. Now, does that sound okay to you? Are you happy for us to proceed, George? Excellent. So the key points to emphasise: a clear introduction of yourself and confirm the customer's identity and consent. Explain the purpose and the process that you are going to follow. Listen to the customer without interruption. Ask open-ended questions. And be mindful of tone, body language, and pace. What simple things can you do at the start of an assessment to help your customer feel comfortable? Any ideas? Absolutely. Offer to make them a coffee. Chat about family or a recent visit. Good job. So conducting the assessment. When you begin the assessment, focus on gathering factual information and observing safely. Ask open-ended questions to encourage natural conversation. For example, tell me how you usually prepare your breakfast. Can you show me how you manage your medication routine? Then we can observe. Whilst the customer is showing you or explaining, you can make a note of their mobility, their mood, and their communication style. Record what you see and hear, but do not include opinions or assumptions. Watch the customer for signs of anxiety, tiredness, or distraction, and offer to take a break or have a drink break. Always respect the customer's privacy and confidentiality. We also need to be aware of any cultural beliefs the customer might have. So always be aware of the customer's cultural beliefs and use interpreters or visual supports if needed. Also, little things make a big difference. For example, walk on the path to the door, not across the lawn. Another example, if the door is shut when you enter, shut it behind you and shut it when you leave. These are all little respectful things that mean all the difference. Avoid assumptions. Ask how the customer prefers to communicate. Are you happy if we just have an informal chat? Think about your last customer interaction. What worked well when building trust and understanding their needs? I read in the case notes that the customer recently went to a grandson's 21st birthday, so I asked them about it. This showed that I took time to prepare and also took an interest on a personal level. Now, practical demonstration. Let's practice how we could conduct a short assessment. So now for some role play. Let's break up into pairs, and whilst one person acts as the assessor and one as the customer. Practice the greeting, gaining consent, asking open-ended questions, and recording their responses. What techniques helped you get clear answers? Yep, giving the customer time to answer and not rush them. Yes, well done. Asking open-ended questions gave me more complete answers. Excellent. Very good. How did you ensure the customer felt respected and heard? Excellent. By listening with intent and by focusing on the person themselves. Good job. Yes, by asking them if they were okay or whether they needed a break or a drink. Excellent. So, in summary, conducting an assessment is about building rapport with the customer, having some chit-chat, making friendly conversation, asking open-ended questions, and listening to their answers, observing the customer safely and objectively, and adapting your approach to the customer's needs. So, on reflection, how can your communication style influence the accuracy of your assessment? So by using open-ended questions like, how are you managing in the shower? You will elicit a response that is, rather than a yes, I'm managing, or no, I'm not managing, the customer will be able to explain that sometimes they have difficulty stepping over the shower ridge, but once in the shower, they are able to hold on to the handrails and support themselves that way. So you can see, by having an open-ended question, you actually receive a much better answer. What would happen if I asked the customer if they were managing to use the toilet okay? Correct. Most likely you'll get a yes or a no answer, nothing else. Whereas if I say, how are you finding going to the toilet? Open-ended question. They can't answer yes or no, so they have to say, well, I'm finding it a little bit hard getting off the toilet, and I don't have any handrails or grab rails to pull on to help me get up. So there you've automatically got an action to have some handrails put in their toilet so that they can help pull themselves off the toilet. So just clarifying, if you ask yes or no questions, the customer has no room to expand and tell you exactly what they do. I always try and speak in a confident, gentle manner, reassuring the customer that this is not a test, but a tool to help us find out if we can be of better service to you. What will you do differently next time you assess a customer? Really, really important point. Thank you for sharing that. Next time, I will make sure I have my ID badge on and show the customer whilst I am at the front door, so they are confident that I am who I say I am. Very, very important to always have your ID on you. It doesn't need to be in sight, but you need to be able to show it to the customer so they know who you are, and so they can have some faith and trust you. So thank you for your participation and attention today with our session on how to conduct the individual's assessment. You should now feel confident in gathering accurate information through respectful observation and communication, how to build rapport, ask effective questions, and record what we see objectively. Remember, our goal is to make every assessment person-centered, where the customer feels safe, respected, and understood. So in our next session, we'll learn how to interpret and report the assessment results professionally and accurately. Thank you for your time today, and we'll see you next week.